Long-term health after pregnancy in your 30s. Welcome back to the module on pregnancy in your 30s. As you settle into life with your baby, it's important to focus not just on their needs, but also on your long-term health. In this section, we will explore how to take care of your body and mind after pregnancy, ensuring a lasting well-being. As you adjust to life with your baby, it is natural to focus on their needs, but your health also deserves attention. Pregnancy and childbirth can bring lasting changes, especially in your 30s, and understanding what to expect can help you feel more in control. One of the key areas to focus on is your pelvic health. During pregnancy and delivery, the pelvic floor muscles stretch significantly, and this can sometimes lead to issues like leaking urine when you sneeze or feeling a pressure in your lower abdomen. And these changes are common, especially if you've had more than one baby or assisted delivery such as vacuum or forceps. Strengthening these muscles with pelvic floor exercises, often called Kegels exercises, can make a big difference. If you're unsure of how to do them, your obstetrician or physiotherapist can guide you. If you've experienced conditions like gestational diabetes or high blood pressure during pregnancy, it is also important to follow up with your obstetrician or even physician. For example, gestational diabetes increases the risk of developing type 2 diabetes mellitus later in life, probably within the next 5 to 10 years. High blood pressure during pregnancy, especially if it was part of a preeclampsia syndrome, may slightly raise the risk of future cardiovascular issues. So, regular health checks, blood tests, blood pressure monitoring can help monitor these risks, and small lifestyle changes like eating a balanced diet, staying active can lower the risks of this. For women considering another pregnancy, it is helpful to know how age may affect your plans. Fertility gradually declines in your 30s with a more noticeable drop after 35. If you're planning to have more children, taking some time to recover fully before trying again can support a healthier pregnancy. Talk to your obstetrician about your specific concerns, and they can guide you on what steps to take, such as improving your fitness or addressing any lingering health issues from your last pregnancy. It's also very important to consider an interpregnancy interval. An ideal interpregnancy interval would be anywhere between 2 to 4 years if it's possible. If you're not planning to conceive again, contraception is another topic to discuss. Family planning options such as hormonal methods, intrauterine devices, or non-hormonal options are all available. There's a big contraceptive basket that you can choose from, and your obstetrician can help you choose what is best for your body and lifestyle. This is also a good time to mention any changes in your cycle or hormonal symptoms, as they may need further evaluation. The most important thing to consider is if you are regularly breastfeeding, your periods can be as late as up to 6 months or even a year. Hormonal changes after birth can lead to shifts in the mood, and while this is normal, it's also important to check in with how you're feeling as time goes on. If you're managing additional responsibilities or feeling more tired than usual, it's okay to reach out for support. Your obstetrician or counselor can help you if you're feeling low. And they may even suggest strategies to help you manage stress and anxiety. So please do reach out. Physical activity is one of the most effective ways to support your recovery and long-term health. Gentle activities like walking, yoga, swimming can rebuild your strength, improve circulation, and boost your energy, and even better your sleep. Once your body feels ready, gradually increasing your activity levels can help with fitness and overall well-being. Nutrition plays a very important, essential role in maintaining health after pregnancy. A diet which is rich in fruits, plenty of variety of vegetables, lean proteins, either plant-based or animal-based, and whole grains support your recovery and keep you energized. The more variety you eat, the less fussy the baby is going to be as well. If you're breastfeeding, you will need extra nutrients to support milk production. So make sure to stay hydrated and include foods with calcium and vitamin D for bone health. Breastfeeding is probably one of the best ways of keeping your baby's nutrition going, because your breast milk is made for your baby, and as the baby grows, the breast milk also undergoes certain changes so that the baby gets the right kind of nutrition. Regular checks with your doctor are an important part of staying healthy after pregnancy. These visits give you the opportunity to discuss any concerns and keeping track of your overall well-being. If you experience complications during pregnancy or delivery, your obstetrician may recommend certain additional screening such as blood pressure monitoring, glucose tests to keep an eye on potential risks. Taking care of yourself after pregnancy is not just about recovery, it is about protecting your health for the future. Protecting your health as importantly as your baby's health. By staying proactive, you're not only supporting your well-being, but also creating a strong foundation for the years ahead.